not a care in the world. Amber eyes, you're giving me butterflies, so I'll drive all day with not a care in the world.
You're between two dumbbells. I'm your host, Skip Hill, and I'm bringing over 40 years of bodybuilding experience to the table, including over 24 years of online coaching. I'm joined today, as usual, by my co-host, Dr. Marv, aka the Educated Meathead. For each show, we posit a thought about a training exercise or training methodology, and then we deep dive into the minutia. We might argue and debate, or we might agree and tell each other how smart we both are, but at the end of the discussion, we both decide if we smash or pass the topic of the day. Of course, we will also be doing another segment of Intimate Time with Skip and Dr. Marv, and then we'll finish, as always, with a few listener questions, which are typically, though not always, related to a past show. Remember, every time you comment on the show on YouTube, you'll be included in a drawing at the end of each month to win a $150 shopping spree from EliteFTS.com and 5 pounds of Team Skip protein from TrueNutrition.com, along with Dr. Marv's online bodybuilding anatomy course. The more times you respond, the better your chances of winning. We'll post the winner for the month on my Intense Muscle IG account, and we will also reach out to the winner.
I know a thing or two about training, but I built a reputation in the bodybuilding industry for removing skin. If you have too much skin, call me. Remember, skin is overrated.
Okay, so today it's my turn to posit, Skip, and I'm going to posit that ab training, and I'll use the word core, but I know we specifically wanted to talk about ab training, is probably overrated from an aesthetic standpoint, but so underrated from a training longevity standpoint that I think people really need to take a second look at their training and maybe start to train their abs and their core, or change how they're training their abs and their core.
Very well said, Dr. There's a joke there that people aren't going to get, but it's funny to us.
Yes.
Okay.
Yep.
Yeah. No, and I agree. I think we're going to agree on a lot of points today, but I think it's important to note that people may be thinking this topic is boring. But I think there's going to be a lot of takeaways. I think there's going to be a lot of, I won't go so far as to say gems. I'll let the listeners and the viewers decide whether they feel they're gems or not. But I do think there's going to be some really good takeaways. So if you're thinking now because you're watching and you're listening, I'm going to tune this one out. Give it a second. Give it a second. Listen to what we have to say. And if you think it's lame halfway through, just skip to Intimate Time.
Because remember what I do for a living. I am a performance chiropractor. So I know core training and ab training better than most. One, from what I do for a living, and two, my own personal struggles. I would throw my back out 2 to 3 times a year where I couldn't walk or train people for 1 to 2 weeks, 2 to 3 times a year for over a decade straight. Then when I learned how to actually breathe and brace, which we'll talk a little bit about today, and start to do proper core training that wasn't just bodybuilder only stuff at the very end of my workout. It's only happened twice in 7 years. And guess what? Both times I quit doing my core work or my ab work, whatever word you want to use. So it could be life-changing in terms of stopping injuries, let alone improving performance in the gym and extending your training career. So it's a very important topic that people, again, just brush over.
And I think it's still important to note that even though I will go on record and say that it's overrated for development, it's still necessary. And you still need to have proper programming, because I think a lot of people, as I said, they're like, oh, I'll just do a bunch of crunches. Yeah, okay, we'll see how far that gets you. And this is ab training too, core training, but ab training more specifically, it will change over time. It has for me. There was a time where it just could be simple and I would get away with it and had a very small waist because I was young. And then we fast forward over 40 years and my ab training, my core training has to be more specific to be able to not see distension from age, from forced eating in the 90s to get huge. And that plays a big part. And then, of course, everybody's going to dive into and wants me to say the hormone game because of potential use of insulin, growth hormone, things like that. Even though I say that it doesn't play as significant of a role as most people think it does. And the reason I say that is there are plenty of people who use a lot of insulin and growth hormone and they don't have distension issues. So we'll get into a lot of that there. It's going to be very nuanced, a lot of information. So hang in there, ride with us, and then make your determination on whether the information is solid.
Yep. Because I will have, and we'll do an anatomy breakdown first, but I have, your traditional bodybuilding stuff that I typically put in somebody's, during the week routine. But in all my routines, all my coaching that I do, there's a day where you're doing HIIT cardio and you're doing outside the box core work that typically you wouldn't think a bodybuilder would do. It's more like athletic performance training. It's in every bodybuilding program for a reason, because we are so stuck going straight up and down only.
Right.
You are leaving yourself so damn vulnerable because guess what, folks? There are 6 planes of motion. We only go up and down. We typically flex and extend only, but there is side to side and there is rotation both ways. And if you're only doing up and down, which is sagittal plane, if you want to be the technical term, you're opening yourself up. And that's what I did, right? Like literally. And it would happen riding an exercise bike, picking a fork up off the ground in a restaurant. Like never a good story. I think only once I was actually lifting something. Usually it was something innocuous. The one time, last time it happened in Cairo school, I helped my buddy. We moved furniture downstairs.
Oh, yeah.
Survived it. Went to reach down to grab the little thing of bungee cords. Felt my multifidi slip and strain, which is not a super common injury, but when it happens, good God, your life is miserable. And I was like, cool. Like somebody had to physically pick me up and carry me back to my to my dorm room, essentially, so to speak, the apartment. And I was like, really? Like I lifted shit all day long, but leaning over, and that's how it happens. It's in my office. 9 times out of 10, somebody comes in with a hot low back. It was something innocuous, picking something up. Very rarely is it lifting.
Out of the 9 major herniations I've had from L4, L5, only 2 happened in the gym.
Yep, that is a common theme.
I took a picture of a chair, just a innocent chair in a counseling lobby. I was taking my son to his appointment, sat in the chair, pop, knew right away. It's like getting kicked in the, it's like getting kicked in the nuts. Doesn't hurt all that terribly bad at that time, but you know what's coming and it gets bad fast.
Yep.
I'd almost rather be kicked in the nuts. I'll be honest.
Oh yeah. Yeah.
Punch me in the dick.
Okay.
I'll take that all day long.
Yep. So here is your 6-pack muscle. The technical term is your rectus abdominis. It attaches from the base of your sternum, called your xiphoid process, all the way down there. Okay. Its main job is to, do sit-ups, but it's also doing something called posterior pelvic tilt, which is tilting the front of your hips up and the backside of your hips down. Think a dog doing its business.
Let's talk about that. Just so that people understand the difference, I think it's important between anterior and posterior pelvic tilt.
Yep. So posterior is when this backside tilts down, right? So it's tilting through the backside. So a dog doing their business, or how you're supposed to do an actual rectus abdominis plank when most people use their hip flexors.
And here's another reference. If you're doing an angle leg press and you're going too deep and your hips are coming underneath you, almost like you're trying to, I'm sorry, but this is the best way to explain it because it'll stick with you. Almost like you're trying to push your dick to the ceiling. As soon as that lower back starts to stretch because the hips are rotating underneath you, they're coming forward. That's the posterior pelvic tilt, and you want to stay away from that. Range of motion for squatting, range of motion for hack squatting, range of motion for leg pressing. You want to go as deep as you can until there's any type of posterior pelvic tilt, and then you better stop it there. Because if you're going to force that range of motion with the depth and those hips are tilting posterior, you are an accident waiting to happen.
Anterior tilt is the opposite, right? Now this is dropping down. It's the what I jokingly call the Instagram you know what model pose, the Instagram butthole model pose. That's anterior pelvic tilting. And guess what? 75% of people have quote unquote resting anterior pelvic tilt. It is not a diagnosis. It is a lot of fear mongering nonsense that I see online. It is quote unquote normal posture. So don't let anybody say, oh, you have anterior pelvic tilt. We need to do 16 to 20 sessions to fix that. That is hogwash.
I was 20 years old and I was diagnosed with that when I went to a pre-employment physical and I had to laugh. Not only that, but I think I was diagnosed with lordosis at the same time.
Yep.
It was kind of a funny thing. But that
you
shows
can't
the
have
times.
one without the other.
Yeah.
Yes.
Those were the times.
Yep.
It's almost like, well, we better throw this in here just in case he hurts himself on the job. And that way he knows and his attorney will know that he was diagnosed with that prior to coming to work.
Yep. Well, that's such a cop out, but yeah, that's probably fine.
Oh, yeah.
Okay, next we've got your obliques. You have two of them, and I have a hilarious way to remember which direction does which.
Okay.
So this is your external oblique. I don't know if it would be a mnemonic, but how I learned it in chiro school is the external oblique X to sex because it's angled down towards your groin, and its action in terms of rotation is contralateral, which means this guy rotates. The left external oblique rotates to the right. So contralateral, C for condom. So the X to sex, and hopefully you're using a condom. Now you know which way it goes, right? And then it'll also help with the left side will help with left lateral flexion, right? And it'll help with just flexion of the spine overall, similar to your rectus abdominis. Below it is your internal. Right now, that's going to do the same side rotation because now those fibers are angled down. So the left side will do left-sided rotation. Yes, it'll still do left lateral flexion and overall flexion of the spine. Right. So there's those. So six-pack, obliques. If we go to the back side, we've got a couple important muscles. So we have your erector muscles that are really big. So there's the full backside. I'm going to take some away. So erectors, if you actually want to know the actual name, the mnemonic is I love spaghetti. Iliocostalis, longissimus, and spinalis. So those are your erectors, right? They're pretty deep. They're a big deal for a lot of stuff. They really do, spinal extension. So extending backwards, not flexing, and whatever side they're on, they will do the same side lateral bending or lateral flexion. So those are those guys. This one, while is not typically considered a core muscle, I'm bringing it up because it's incredibly important. It's very deep. It is called your quadratus lumborum. We call it your QL for short because nobody's saying quadratus lumborum a million times.
Right.
It is incredibly important. You could see it goes from and I didn't do the attachments and insertions for the other muscles, but people could see, right? It goes from your hips to the bottom of your ribs. Powerlifters and bodybuilders are notorious for QL issues because of what did I say earlier? We only go straight up and down. We don't do rotation. We don't do side bending. This is one of those muscles in the low back that causes a hell of a lot of pain. It is something that I am treating kind of like I talked about, like the levator scapula. I treat it more than almost any other muscle. In the low back, I'm treating this quite often as well.
I think a lot of people may think, I pulled an erector. And the vast majority of the time, it's probably a QL issue.
Completely agree. So it does the same side lateral flexion. It stabilizes your back. And then obviously this is a floating rib. So it stabilizes that during breathing. Massively important. And I think getting it strong is really important. And then getting it to release by getting your body to move in that it's up and down plane while walking is really important. So we'll get to that because, of course, we're going to give examples of how you would train all those muscles. But the QL is one that people don't talk about enough. We're going to keep going. There's another muscle that is really important that people don't consider part of the core. And ladies and gentlemen, that is your diaphragm. And yes, its job is to breathe. So fun fact, when it contracts, it actually lowers. And when you exhale, it actually raises, but it is a huge spinal stabilizer. And if you are breathing and bracing correctly, and we know I'm a proponent of the DNS, dynamic neuromuscular stabilization bracing, that I gave away in the squat episode. So tune back to that if you didn't see that, because I gave away my big secret of how to brace. That is massive for stabilizing your low back. So people with low back issues, a lot of times they're not breathing properly. Same with the neck we talked about last week, or the last recording we did. No, we talked about in the trap episode. Yeah. If you're not breathing right, it could cause neck pain and it could cause low back pain. Right. And then we also have your TVA, right? That's the vacuum muscle. Remember, for a while, TVA caused low back pain. That was the only thing you needed to work on. That is not true. But anyways, it's really important. It does the vacuum and it increases intra-abdominal pressure when you're bracing. And then the last one to really show, and these are, I got to go one layer less. These are way bigger than what they really are. They are your multifidi. And these, along with like these guys here, your interspinalis, blah, 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 we don't have conscious control of them. So one, for a while, it was theorized by doing a vacuum, by activating your TVA, you're activating your multifidi. But really, it's going to, any sort of bracing or spinal movement, you know, it stabilizes the spine. Yes, it helps a little bit of extension. Yes, it helps with opposite side rotation. The big thing with these, though, they are our main stabilizers in between our spine, especially in the lumbar spine. As we are folding forward and flexing, at a certain point, they are going to start to relax on their own so the bones could separate to allow you to continue to flex forward. That is why I am so big on, as a performance chiropractor, your RDLs. Once your hips quit moving back, you're done. I know I'm going to get a lot of flack for this. Deficit deads, deficit RDLs, blah, blah, blah. I don't like them because your stabilizers are relaxing. Yes, are they great erector movements? Absolutely. I am not arguing that. But the number of times people have come in, if it's going to be a weightlifting injury, more often than not, it is a deficit, dead, RDL, whatever. So that's why once your hips quit moving back, I want you to cut that range of motion off, because you fully lengthen glutes and hamstrings. Anything else is going in the low back. Your erectors are getting plenty of work, right? So I think that's really the main muscles for today to discuss. And then
we're
obviously
on the same page when it comes to things like deficit. To me, it just seems like a gamble that is not necessary when you already are going to nail those target muscles anyway, without going into that range of motion that is arguably going to create a huge, huge vulnerability.
Completely agree. Yep. And I'm not, look, again, they're for hypertrophy. I mean, it's hard. I love when people do hard stuff, but the risk to reward, even though I don't really like that term, it's not there. It's just not, because you're still getting, you're still getting stimulus to your erectors. Let's just do it a little bit smarter. So that is the anatomy breakdown. Where do you want to take it next?
The actual training and getting into the exercises, I think, is a good call. I did want to touch on one thing, and I can't remember the name, but the muscles of around the spine for the diaphragm. There is, and correct me if I'm wrong, there are times where I will have a sharp stabbing pain inside of my right scapula, and I say that is typically that muscle, maybe even a little bit of a trigger point, because if I lie down on my stomach and I have my wife drive her heel into that spot while she's standing, it will loosen up. It'll kind of give way. Is that same diaphragm muscle? And the reason I ask is because I can feel it when I take a deep breath. It's like if I start to inhale, it's kind of, it'll catch up. Oh yeah, I don't want to take too deep of a breath.
Yeah. So here's your rhomboids. You are most likely discussing this guy called your serratus posterior superior.
That's a little bit higher than where I'm feeling it.
Okay, so then it could be rhomboid, or it could be your spinal stabilizers, right? So you have this guy comes all the way down from your neck, right? It's one of your cervical spine erector spinae. your erector. Sorry, shouldn't use the full term, but yeah, it could be that guy. It could be rhomboid as well. And then these are your erectors.
That is where I'm feeling it.
Okay. Yep.
But
and
on the other side, that is
okay.
almost
Yep.
pretty much
So
where
right
your
there.
arrow
Yep.
is. Right there is where
Yep.
her heel will go.
Okay. Yeah. So, and these, your thoracic spine erectors is what controls the curve of your lumbar spine,
Okay.
not your lumbar erectors. So just fun fact. So maybe with remember your hyperlordotic, Skip, you're broken.
Exactly.
That might be overactive, and we're going to have to do 20 sessions to fix this. Yeah.
I'll be on a plane tomorrow.
Yep. So there's that. So I am big on, and yes, I am biased of my personal experience, but what I do for a living, you could, I personally like doing direct ab work. How do I say this? I really like a very thick abdominal wall. Not everybody does. That is the subjective part of what we do. I just dig super thick, blocky abs. I'm drawn to that. I don't know why. For certain divisions, if you are a competitor, you don't have to be a competitor to be a bodybuilder. It might not behoove you very well, but I am drawn to a very hypertrophied ab wall, but to each their own. But I'm really big on training different outside the box ways as bodybuilders or lifting enthusiasts, whatever word you want to use. That's going to make you incredibly resilient, because if you only go up and down, your life doesn't happen straight up and down, perfectly balanced.
Mm-hmm. And I don't want to say I'm completely the opposite, but I am very, very simple and very routine when it comes to my ab and oblique training. And I want to get the oblique part in there because I think that people don't give much of a focus to oblique training. And I think that you're missing the mark if that's the case. People tend to think that if I train my obliques, they might grow, and then I'm going to have a midsection that looks like Rich Gaspari versus having a, more streamlined and smaller men's physique type of midsection. And I don't think that's the case at all. Now, if you're going to do the old school heavy side bends with dumbbells, yeah, you're probably going to get hypertrophy out of your obliques, and you can get too much, and it can not be a good look. But again, coming back to the stabilization for the lower back, huge, huge. But also from a development or an aesthetic standpoint as well. Now, when we get into our specific exercises, I think yours are going to be, I might not even do many or any of the exercises that you do.
Yep.
And mine are more, I guess, along the lines of typical type of bodybuilding training, but there's a method to the madness. So I don't know if you want to take it first or if you want me to take it first.
You go first, because I'm sure I'll do some of the same stuff you do. And a lot of my core stuff, like I said, is just getting people resilient in all directions. Because really for bodybuilding aesthetics, there's probably 2 to 3 movements that I really am big on. And the rest are performance or just longevity, I guess, for lack of a better word, even though I don't really like that word in this scenario.
Right. But it still fits as far as, lower back health and things like that. So
performance chiropractic and sports medicine in the Houston Bay area, telemedicine and nutrition coaching all over Texas. And if you're not in Texas, don't worry. You still do consults through the educatedmeathead.com, where you also find workout programs, seminar recordings, and online courses.
My ab training, my core training, my oblique training is very specific to the situations that I've had with chronic lower back issues, but also my poor shoulder to waist ratio. And the fact that because I've been training for over 40 years and I have been through the 90s version of forcing muscle size by force eating, high volume of food, things like that, this is how I focus my training. Now, again, I think people's core training, it's going to be individualized to what, like, are you younger? Do you have lower back injuries or you haven't? If you haven't, doesn't mean that you shouldn't be focusing on it. You want to be proactive. You don't want to 20 years down the road or 10 years down the road, start having those lower back issues. There was a time where I didn't even train abs because visually I was stuck in the aesthetic component. I'm like, I'm going to keep this small waist. And it worked in the sense that I was still squatting. I was still doing a lot of exercises where my midsection was still being trained and it was strong, but I wasn't doing specific targeted midsection work. And in retrospect, I wish I would have. That may have been a huge mistake early on. Who knows? Maybe I wouldn't have had the lower back issues that I ended up having. Or maybe I wouldn't have as much of an issue with distension because my core would have been stronger, arguably even TVA, to be able to basically hold your guts in. So this is how I structure my ab training as recently as last week and will be coming up this week. I only train my midsection. I make sure I train it once a week, but typically it's twice a week. I will start with the basic type of crunch move. I don't have a wide variety of crunch machines at the gym that I train in. I train in a 24/7 garage style type gym. So my typical crunch exercise that I open with, and I train abs at the end of my workout after back, is a kneeling rope crunch. You'll see it here. Now, I'll do them standing on occasion, but I feel like when I do them standing, the range of motion it's very limited. I don't get as much of a stretch. You can't lift your rib cage as high, that sort of thing. So I prefer them kneeling. I want to train them as heavy as I can, but still be able to get and have the mechanics fit to where I have a full extension or relatively full extension and a full contraction. It's not an exercise that I want to pound extra weight. I already have a very thick abdominal wall anyway. I think the vast majority of people have enough abdominal muscle. The musculature is there. But if you get lean and your ab wall is thin and you don't have detail in your abs, then you're one of those people that have to literally train your abs to grow. And that means, in my opinion, maybe not doing reps of 6 to 8 or sets of 6 to 8, but you need to train them harder, much like you would any other muscle group that you're trying to get to grow. So the whole 15 to 20, perfect crunches and everything, it's really not going to get you very far. I'm using the crunch primarily, not necessarily as a warm-up, but to get a lot of blood in there before I move to what I consider exercises that are more important for the development for what I'm looking for and for that lower back protective type of situation. So my next exercise typically will be lying, and you'll see it here, but I have a hard time explaining it because I have a hard time putting a label on it. So if you don't see it, but I explain it to you, you might be, I don't know what that is. Essentially, it looks like a lying leg lift on a bench, but it starts as a leg lift in the extension, and then it's a knee to the chest crunch. Okay. So I'm going to exaggerate the stretch. A lot of times I'll touch my heel to the floor. My glutes are, as you can see, right on the edge of the bench. And then I'm taking, and these are controlled. They're very methodical. And then from there, my next exercise will be more of a stiff leg, not completely stiff leg, but I'm not going to crunch and pull the knees into my chest. It's more of a lying leg lift. Now, I don't do hanging leg lifts, not because I don't like them, but because I don't like to hang from a bar. I like the exercise where you're resting on your forearms, and we don't have one of those at Atlantic Fitness. So for me to hang after I train back, my grip is gone. I know there are other options like the elbow sleeves. We don't have those. At the same time, I've used them before, and if you use those after you train back, your back isn't going to hold you very long. And typically the fatigue that is already there from training back, I'm going to fatigue there before my abs fully fatigue. So the other part is I think that the lying leg lift, a lot of people don't like them. And some people will say it puts the lower back in a vulnerable position. I don't find that. And I have a history of chronic lower back issues, but I've been injury-free for 9 years. And I think this exercise is one of the main reasons. Obviously, the stretching and the protocol that I use has kept me injury-free as well and gets the massive part of the credit. But this exercise is important for all those stabilizers through that, I want to say, lower ab or hip area versus the abdominal wall. I mean, it's essentially kind of I don't want to say a moving plank when it comes to the abdominal wall, but that's the best way for me to explain it. I want to work all those stabilizers in there. And sometimes I'll pull a little bit to the left on one, I'll pull a little bit to the right on the other, but I'm not doing a lot of rotation until I finish with the cable wood chopper. And we might do these a little bit differently. You tend to pull, and people will see this, the comparison. You tend to pull kind of straight across. I pull high to low. And honestly, I can't even say that there's that is beneficial from an anatomical standpoint or a mechanical standpoint, but I feel that it is while I'm doing the movement. So, and then of course, what I do is I alternate one week or one workout with the wood chop, finishing with the wood chopper. And then the other week I will do the one arm cable oblique kind of crunch. And I want to say oblique, intercostal, serratus type of thing. Typically, I don't do that movement until I'm prepping. So I'm doing that exercise more for the aesthetic component, but the wood chopper, I think, arguably probably works that area harder and is going to provide more protective stability for the lower back than the side bend, does, or the side crunch. Thoughts on those exercises?
Yeah, I like just about all of them. So when it comes to traditional crunching motion, kneeling cable crunch is my go-to. If you have a good ab crunch machine that's actually biomechanically sound, go for that. I like hanging leg raises if you are strong enough, but people do. And before I forget, just know there is a reason why the military took sit-ups out of its PT testing, because of the compressive and shearing force on the low back. So I'm not a fan of traditional sit-ups, full stop, because it's a lot. Off the top of my head, it's like 3,000 newtons of compressive pressure. That's a lot for people. So I'm not a traditional fan of traditional sit-ups. And the military took them out, so that should mean a lot.
What about partial? On occasion, I'll do a partial slight decline.
Yeah, like even that is if you're getting a lot of spinal flexion, fine. But if you're doing the hip flexor version that people do, that's just shearing. I stay crazy.
In the top 1/3 or 1/4.
Yep.
So so are you saying there's a bit of a argument that that's a decent range of motion to stay in?
Yes, to each person, because like the example is my dad has done 300 sit-ups every day of his life. If I do a sit-up with my low back, I can't. I will be in trouble. So I definitely am not going to go back very far. No question.
Yeah. And it's kind of a finisher. After I've done the other ab work, I'll get in there and I'll just kind of burn them at the top. And when I say 1/3, that's me. I don't know. Correct. I'm not measuring the range of motion, but that's what it feels like. 1/3, 1/4 in there somewhere. I am definitely not going to drop very far.
Correct.
Very far back. And I find it difficult. Here's an example too. I find it difficult if the knees are raised, because I can breathe. I need my knees to be lower, like a typical decline sit-up bench, kind of an old school. Versus if they're elevated. If they're elevated, I can't breathe. I just can't breathe.
Yeah, that should, on paper in a vacuum, be reasonable. But yeah, the kneeling cable crunch is my go-to for my top down, or if you have a good machine. I'm big on crunching top down and then bottom up. However, a lot of people don't do the hanging leg raises right. If you have a captain chair, like what you don't have, great. I have hanging leg raise and an ab crunch machine in my garage. So I do top down, bottom up quite a bit. But
let's talk about the top down, bottom up though, because I don't know if people understand that. I think most people focus on the movement of the shoulders. Take your shoulders down. Now here's another cue, and I understand somebody's going to have a problem with it, but it'll stick in your brain. Okay. When it's top down, bottom up, or top down, bottom up, you're basically saying, you can't forget the posterior tilt. Essentially, it's the posterior tilt of the hip. So this is what I explain to people you can demonstrate it better visually than you can explaining it like we are now. So it's going to be important. And sometimes it's visually difficult to see, but the shoulders and the hips need to be coming together at the same time, not just shoulders. And of course, not just hips. So this is the cue. Take it or leave it. You want to crunch it. You're trying to get in your mouth. You're trying. I'm sorry, but that's the visual that sticks.
The visual I use is show your taint to the mirror in front of you.
Oh, okay. We're in the same ballpark, but mine's a little bit more graphic than yours is. Yeah.
Because so your quad could flex your hip to about 90, then your hip flexors probably 80 degrees, maybe up to 90 for the rec fem, then hip flexors. But to really get the lower abs to really be doing it, you have to get, like Skip's talking about, that posterior tilt. So most people's hanging leg raise are quad and hip flexor based. That's why your quads are on fire, but you're not getting anything right below your belly button that's relatively unscathed. So if you're not strong enough, then doing things like what Skip did, I didn't send you earlier, I'll show on the screen right now, just lying face up and using like a cable machine or a resistance band to kind of mimic a hanging leg raise while lying on the ground if you're not strong enough. Because it does. When people do, I'm doing 30 reps of hanging leg raises, I'm like, you are not doing them right. Full stop.
Right.
Like hanging leg raises are incredibly difficult if you actually want to get into your abs. Now, if you're doing them for your hip flexors, knock yourself out. But to get it on the abs is incredibly difficult to do so. So that's what I do there. But those are really, like Skip was talking about, I'm big on where is the action coming from? Get the top down, which is what most people do, but people don't do bottom up. And if you want a thick, awesome abdominal wall when you're lean and you want those lower abs, you've got to go out of your way to try and get engagement. Same with a plank. Where
very good point. I was going to go there as well.
Most people's hips are way too high. So I'm going to have that video added right now. So the video's on the screen right now. People's hips are way too high, or they're doing that anterior pelvic tilt, and it is a lot of hip flexor. This is when you want to tuck your tailbone like you're a dog doing your business. You will no longer be able to do a 3-minute plank. You might only last 30 to 45 seconds the first time. You will be blown away when you actually feel your lower abs engage to do that tilt and have to stabilize. So when people go, I could do a 5-minute plank, I'm like, you could do a hip flexor plank.
Can you do it correctly? Yeah.
Yes. There will be times in office where I have to take a big, strong person and maybe go, we're aiming for just 20 seconds for this set. That's it. Like, it's brutal when you do it right. What's really cool is buddies who work at the VA hospital in Palo Alto, they're chiros there, and they know if they could get and let's just say combat vet, but if they get a veteran who's had chronic low back pain to do a proper plank for 1 minute, the odds of him coming back in and then for low back pain are nil to none. It's very rare. That is a major milestone that they focus on. And oftentimes they go, here's your TRX suspension trainer, keep doing your core work. I'll probably never see you again. Like, that's how impactful it is.
Now, what if we're going to put arbitrary numbers on it to make a point? I would say that the movement at the shoulder is 80% and the movement of the hip is 20%. Do you find that to be relatively close? My point with those numbers is the movement of the hip is it's going to be subtle in comparison to the amount of movement at the shoulder. And I think that's why it's easily lost. People don't see it on the leg lift, on the plank crunch, things like that. A plank crunch it's a wow. It's a wow. It will take you, like you said, that long plank down to nothing and make you go, I do not like to do these.
Yeah. I think that makes a good off the top of my head representation. So it
may not be completely accurate, but
correct.
the numbers
but it gives you an idea. Yeah, where it's subtle, but once you feel it, like I will literally go, okay, let's try and get 5 perfect reps on a hanging leg raise right now. 5, just 5. And a lot of times people can't do it. It takes them a couple weeks to get it. So doesn't mean you throw it out. It's an area of opportunity, but just stick with it. So those are typically my crunching motions. I like wood choppers because when do most people get hurt? Rotating, right? So
that's why these injuries happen outside of the gym.
Correct.
When we're in the gym, everything is very linear, it's very routine,
Controlled.
It's very, right. We're in that same movement plane, and everything is tight. We know that we're training a little heavier. We're in the middle of or we're starting an exercise. Everything is tight and everything is where it's supposed to be. When you leave the gym and you drop something on the floor, say in the post office, and you go to pick it up, you're not staying tight. You're just, you're picking it up and you're reaching with one hand. And then all of a sudden you're incapacitated. And the lady behind the desk doesn't understand what's happening, or behind the counter. And you have to laugh and say, I am totally right now and need to leave. And then you come back in 3 weeks and explain what happened, and that you were in bed for 3 days because you couldn't move.
Man, it's like that actually happened to you and you're speaking from firsthand experience.
Yeah. Honestly, and every one of them, every one of the 9 stand out.
Yep.
I have written articles about getting stuck on the toilet the following morning, because everybody wakes up super stiff. When you're moving around, you have a lower back. Throughout the day, you're moving around. There's blood flow. You're warm. You're like, oh, okay, it's getting better. You lie in the same position for 6 to 8 hours, and you get up. And the older you get, let me tell you, as soon as you hit nicotine or you smell coffee, you're not 22 anymore. You better be a minute or 2 from the bathroom, because you got to go and you're still stiff. So sitting on the toilet is bad enough. But then you become a dumbass and you lean back.
Yep.
And you can't sit back upright because your lower back is spasming. Yep. So for 3.5 hours, I was stuck on the toilet. Now I've got a wife of 32nd anniversary is coming up. Love her to death. She's awesome. She says to me, well, I could, do what you need to, so you can get off the toilet. No, I still have a little bit of pride and a little bit of, like, I appreciate you. I love you to death. And that says a lot that you would do that. But at this point, if I could just slide off of this toilet to the floor, I would do that and just stay in that position all nasty for a day and a half. But I couldn't even bring myself to do that. It took a beer, and I don't drink. It took a beer and 2 Percocets, 3.5 hours. And I was able to get up off of the toilet. So what happened the next day? I shit in the shower standing up. Yep. It is the most humbling, arguably shameful thing, because it's not embarrassing because no one else is around. So that's why I use the term shame.
You did Andre the Giant.
It was horrible. It was just horrible. Like this, and nothing will make you feel older. If you're young and you have a lower back injury, that's one thing. If you're older and you have a lower back injury, honestly, you feel like when you're walking, like you need a walker with tennis balls, and everybody's like, oh, that poor old man. Wow, he's in pretty good shape for being so decrepit. Yeah. It's very, very humbling. It sucks.
So let's do a quick tangent. Heaven forbid you're in that scenario. Real quickly, in office, dry needling with E-stim is my go-to for a hot low back. If somebody can't handle needles or it's inappropriate, I do electrified glove with my newbie E-stim machine. That works really, really well. But in terms of exercises, especially because it's going to tighten up over the night. So that's when super boring cat cows, legs only bird dogs, and then getting the hip to relax with like a figure 4 seated stretch where you're activating. That's what I have all patients do when they have a hot low back. It's going to get worse during the night. People poo-poo cat cows and bird dogs. When you have a muscle spasm, that's how you're going to get it to try to calm down. And then if you can get manual treatment, this is not just because it's what I do for a living. It will reduce the downtime dramatically. Meaning, if when I would throw out my back, it would be anywhere from 1 to 3 weeks before I'm fully recovering. If I do it, and if I could get needled within a day or 2, it's 3 to 4 days. That's a huge downtime, right? Also, you could do something called an SI belt, which is a belt wrapped around your SI joint. So it's below your normal belt line. That will compress the pelvis, which will provide a sense of stability to the low back. It is either something where you put it on, you're like, oh my God, it's life-changing, which is why I always have mine with me in office. Heaven forbid I tweak something, I could still work, or you won't notice it. But just trying to give people options, right? Try an SI belt. You don't have to buy one. You could put on multiple belts wrap them really tight, use an ace bandage, use your knee wraps, just some sort of pressure.
Mhm.
And then cat cows, legs only, bird dogs. I don't want you doing the arm only. I just want you doing legs only. If you have a massage gun, if you have somebody who could help massage gun your low back to try to help your brain connect to those multifidi and those spinal stabilizers that are spasming that you can't consciously control, that'll help. And then just know your body's doing its job, like we've talked about, is trying to create a brace or a splint.
Right.
And then everything's going to spasm and tighten. That's why, people, they can't fully extend or they get stuck. They stand up. They can't stand up all the way. They're hunched over. That's what's happening. So those things could be incredibly impactful. And then I use, like I've talked about, biomechanical tape, which was acting like another layer of erector muscles to offload a ton. You could buy dynamic tape on Amazon. I get no money saying that, right? But there are options. If heaven forbid, this is something that is a common theme for you. One, you need to figure out what's going on. So a lot of times it's not good core control in multiple planes of motion. Also tight hips, especially lacking internal rotation, is
And
a
typically on
huge
one
driver.
side.
Yep.
I think people need to understand, because I know early on when I had these back injuries, I was like, just leave it alone, because all you're going to do is make it worse. That's not true. And I think that's what people need to understand. That spasm is those muscles locking down to brace.
Yep.
It's a natural, instinctive, almost kind of like primal type of body response. What you want to do to get rid of the pain is to loosen those muscles up. So the actual stretching, even just minor stretching, you'd be surprised, just minor stretch, don't force it, and it'll start to release. Then you'll be like, oh, then I can, a little bit more. Oh, it's released. Now, is it going to stay released? Maybe not, but it is some respite from the pain while you're loosening it up. Had I known then what I know now, I would have done those stretches. And if I do tweak, there's a instance every now and then where I might tweak a little something. I go, ooh, okay, it's not an injury, but it's a little bit, and I make damn sure that I am stretching that side, because that's the imbalance. It's pulling on one side. And if you have that flexibility and that range of motion on both sides, then typically you're not going to run into these types of issues where you're going to end up with some sort of spasm and end up with a herniation and everything else. And this is another rabbit hole that we really don't have time to go down, but there's a difference between a herniation and a pulled muscle. So there is that too. Sometimes it's very difficult to differentiate between what is one and what is the other.
But the good news is the worse,
everything.
The worse the disc injury, the better your body is at healing itself. So the worst possible injury, where people call it a jelly donut, whatever, we'll talk about that another day, that actually breaks off, gets all the way through the outer ring and is in your spinal canal. Your body spontaneously heals itself 94% of the time. Like, we're remarkable at healing, but that spasm is what hurts like hell. So just keep that in mind. And then once you do those exercises and get it released a little bit, like the range of motion with the cat cow will slowly increase as you keep going. Once you get it warmed up a little bit, walking is your best friend. Motion is lotion. God, I hate the phrase. I say it every single day in office because it's true. Walking, not going 5 miles away from home, staying in a responsible vicinity.
Yeah, you don't want to be too far.
Yes, correct. But that's amazing. So just heaven forbid you have a hot low back. That's what I would recommend. Back to exercises. So we talked about crunching, leg raises, modifications of leg raises. I do a lot of really outside the box stuff. And when I typically program, like I said, I'll have a HIIT cardio day followed by, I guess you would call it a functional core day, where it almost is like athlete based, not CrossFit, but like just weird different motions, because I'm big at building that resiliency. So I will just throw a couple up on screen. So standing, I don't know what they're called. I kind of was messing around one day. I call them standing kettlebell athlete swings. You could do them with a dumbbell, where there's a million ways to do it. You could kneel, you could be in a lunge, you're moving your arms around, do whatever, but you're practicing bracing and not letting your hips getting pulled all the way around. It doesn't look like much. I promise you do it. You've never felt your core and glutes and legs have to work together so damn hard. So I'm a big fan of that. We know I love my carries. Suitcase carries are an awesome way to work on internal rotation of the hip. So it is a hip mobility drill. So that's like your final warm up, first exercise of the day. There's a million version of carries. Carries, though, let me do two really important things why I think they matter. One, they replicate the real world more because very rarely do we have equally balanced things. It's also my favorite way to strengthen the QL, which is a muscle we typically neglect. Two, say you have a 60-pound weight in one hand doing a walk, and you got to walk slow. When you walk slow, you'll feel how much your foot has to work. Remember, we've talked about foot biomechanics. Go to the calf training episode, because otherwise this is going to be a 7-hour dissertation by yours truly, and nobody's got time for that. But 60-pound weight in one hand, and I'm making numbers up, will actually load and tax your core more than two 70-pound weights in each hand. Even though it's less than half the load, because it's uneven,
Right.
your core has to work. So big bang for your buck. And you could do racked position. There's a million different versions of carries and a million different versions of suitcase carries. We've talked about wood choppers. I'll even program them with kneeling. I am big on what I call core activations right before a spinal loading exercise, because by activating your core, you should be able to have less RPE and feel stronger when you're doing a squat, a deadlift, a hinge motion. So I've got a couple different core activations where you're essentially resisting motion, turning everything on. You could do your planks. I love Palloff presses. They get a bad rap. There's a million variations. I love heavy Zercher holds. So not even squats, just unrack a bar in the crease of your arms, bend your knees 20 degrees, breathe and make it heavy and hold that for 10 to 20 seconds. You're practicing keeping your hips and rib cage perfectly stacked. So it's perfect at teaching somebody how to breathe and brace under load. But man, those are humbling. You put 275 on a bar and you unrack it and you hold that position for 10 to 20 seconds, rack it, get your breathing back to normal. And then you do, your bent over barbell row or your one arm dumbbell row or whatever you're doing. I think you're going to be pleasantly surprised by how much easier it is to stabilize and activate your core. Like there's a million of those. What else? A drag across plank is a loaded bird dog. So Stu McGill Big Three, curls up, bird dogs, and side planks. A lot of people poo-poo them. What he was doing was creating movements that resisted all three planes of motion, right? So curl up was the flexion and extension. The bird dog is limiting the rotation, and the side plank is limiting side to side. So he was saying, hey, let's get you strong in all three planes of motion. People don't do bird dogs right. If you do them with the bracing strategy that I have shown on the squat episode, it's a different game changer. But say you want to load it, a drag across plank like you see on the screen right now is a loaded bird dog. It is humbling. I love grabbing my sandbag with my big powerlifters, strongmen. Some of them are over 400 pounds, squatting over 900 pounds, and a 25-pound sandbag. They are shaking like a leaf, having a hard time stabilizing. I'm like, boom, there's a loaded bird dog. There you go. And then you see it click and they go, oh, good God. They get really strong at that. Watch everything go up. Reverse hypers are awesome. Not everybody has access to them from West Side, so that's unfortunate. But Matt Wenning, so obviously super smart and super gifted powerlifter. This is his version of doing a banded version, so that's on screen. So you could do it, you could make your own with a bench and blah, 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 but that banded version is awesome. And then you could do offset barbell work where, either weights on one side only of a barbell and you're doing an RDL, or you're just holding the bar that's not even. Like that is brutal. And then sandbags. I love sandbags, but not everybody has them. So I won't talk too much about them. Just when I learned the brace, when I started doing all these outside the box movements and sandbags in particular, that's what changed my life with my low back issues and why I'm so headstrong about, even if you have a good no back issues, you're young, you're Gumby, let's start programming these weird outside the box programs now. So your core is incredibly resilient in all three planes of motion, because that's what you need for day-to-day life. And I have a million more, but let's just leave it at that.
Yeah. And I did want to throw out just real quick, kind of between the two of us, a handful of exercises that are actually just weight training exercises for other muscle groups that you can do one side at a time to increase the effectiveness of, say, or stability, I guess, or bracing for obliques or abs. And one that comes to mind is the standing one arm side lateral. Because of that brace, as soon as you kick that dumbbell out controlled to the left side with the left arm, you're going to find that your right oblique has to stabilize. It has to do a lot of stabilization. Obviously, like a one arm landmine press, even overhead dumbbell, even push press, or overhead standing shoulder press. Those types, especially if they're one arm, things like that are incredibly important to throw in every now and then, because again, working that one side, you're going to have to focus and you have no choice. The core has to stabilize on that one side versus if you're doing both sides at the same time.
One of my favorite core exercises of all time is a one arm heavy dumbbell row. Period. And especially with, I cue them differently the most. I do the setup difference.
With or without bracing?
What do you mean? Oh, well, like with your arm supported?
Right.
I'll do both.
Okay. But my point in asking that is so many people will not even think about doing them without bracing. But do them without bracing.
Yeah. Oh yeah. And like, that's when I write programs, like, you know, obviously not everybody comes to me as a bodybuilder or competitor. Like for Gen Pop, if I could get you to squat, if I could get you to one arm dumbbell row, something for your hamstrings and a face pull, that's it. Like if I have soccer mom Susie or somebody's mom coming in or grandma, well, I can't, it doesn't matter. If I get them to do those 4 movements, boom, they're great. And the one arm row is doubling up as a core exercise. That is brutal. And you could do with bracing, offset the arm. You could have to stabilize in space. Like it doesn't have to be the super boring, like you said earlier, body weight only 100 rep sets of leg lifts and crunches. That's right. So wrong. That's not even close. Like think outside the box, make sure stuff's uneven. It's amazing what you could do.
Agreed. We're going to move to the smash or pass.
Yeah. And then just real quick.
It's going to be a hard one.
Yeah. So let me just do 1-2 things. Just know that we do have studies saying adding core specific movements in addition to your normal training makes life better. So yes, you're getting core workouts going, but if you have a history of low back pain, working on core, working on spinal stabilization works, full stop. So start building it in now, like we talked about. The research is pretty damn clear, right? So just,
and even if you don't, increasing that core strength is going to help you to increase the poundages that you're using on bent over rows and these types of movements that need the bracing anyway. Squatting. Deads.
Yes, exactly. So like grab a band, wrap it on the rack, and we'll do the smash or pass, I promise. Grab a medium to heavy band, wrap it on the rack that you're about to do squats or whatever. And then in between your warm-up sets, do payloft presses, but make the band tension really hard. And you could stagger your feet. You could move your arms up and down. You could do a partial squat pattern, do both sides in between your warm-up sets. When you get to your working weight, I guarantee you it's going to feel lighter. I promise you it will. If it doesn't, slam me in the comments. If you're actually doing it, that's how confident I am. Activating your core before spinal loading makes a world of difference. We do activation for every other muscle, right? Oh, I'm going to do chest. Let me do an activation. Let me do cable flies or the shrug we showed on here. But nobody wants to activate their core, or nobody wants to load their core with external loading. Like it's just stop the nonsense. Sorry, soapbox done.
All right. Smash or pass.
Man, this is going to be really hard, guys. I don't know.
I know, right?
No. Well, I will pass on the initial posit because I still like direct core work for aesthetics because I am drawn to thicker development. That's just a personal preference. I recognize depending on if you are a competitor, that might not be ideal. I like big ass blocky abs and I like big obliques. I just do. That's personal. For sure, smashing on, start doing core work, not traditional stuff, to extend your lifting career and improve your performance.
Mine's easy. I mean, it's just a smash 100% on pretty much everything. And I want to point this out. I don't think, and I don't want the listeners or the viewers to come away with this idea. So this is why I say this. I don't think training the abs and training your core will increase, if from a hypertrophy standpoint, significantly the musculature of your midsection, unless you're training those muscle groups like you would train chest or legs with very heavy weights, forcing them to grow. And I did point out, and I want to point out again, that if you do have a thin abdominal wall, some people do, then you're going to want to train that way anyway. So where I say that it's overrated for aesthetics and for midsection, I mean training it intensely and approaching ab training like you would approach any other muscle group. So it's just a 100% smash for me, whether it's from an aesthetic standpoint, for the visual of the physique, whether you compete or not. Just having good ab development is good from an aesthetic standpoint, visual standpoint, but it is crucial for longevity when it comes to training and being able to train heavy and to try to avoid or decrease the vulnerability of any type of injury through your lower back. Are you going to be able to stay away from all injuries? Of course not. Are you going to minimize not only the potential for injury, but the extent of the injury by training your core and having a strong core? Absolutely 100%. If you don't do it because you're focused more on, I just got to get huge and it's all about bodybuilding and I'll just deal with the injuries, you're leaving way too much on the table. And quite frankly, I'm going to go so far as to say I would question then your overall like training intelligence, if you will, because it's just so obviously important that you're leaving out a key element that can help your progress, not even just from an injury standpoint, but from progressing in those bigger lifts for years and years moving forward. Then it's just a 100% smash.
Amen. And you don't have to do all the movements we talked about today, right?
Sure,
Don't do them all in one day.
Doesn't need to be an hour type thing, but I'm going to say one more thing, and they're not going to hear it if they tuned out. But if you tuned out of this because you didn't think it was important, that says a lot right there. It's like, well, you're probably going to you're going to see us because you're going to Google in a year or 3 years or what, if you have some type of injury or you have, and then you're going to figure it out and go, oh man, they were talking about this back in 2025. I should have listened. Skip said I was that guy because I didn't want to listen to it. There you go.
I don't see nothing wrong.
Today, I've got 10 questions for Dr. Marv. All 10 questions cannot be related to the industry, working out, our jobs in the industry, nothing. In fact, these 10 are going to be specifically about if you were to win $150 million in the Powerball.
Ooh, all right.
I always like these.
Yeah.
I do. I like these. All right. Number one, do you tell anyone that you won $150 million? And if so, who?
Tell my future wife. And maybe my dad and sister. No, actually, I wouldn't because they can't keep their mouth shut. Yeah, she would be the only one who would know.
Good call.
There would be signs. I mean, I would drive like a Millennium Falcon to work. But
exactly.
Yeah.
Number two, do you continue to do the work you do now, or would you retire ASAP?
I might not work 100 hours a week. I might say, hey, I'm going to treat patients 2 days a week and work 1 to 2 days a week on online stuff that I want to do. I would hire a bunch of people to help me put together my online stuff, but I would always do what I do because this is what I was put on the earth to do.
I kind of broke my own rule with that question, but it was an important question because
it's not directly related,
right?
But
exactly.
Correct. Yeah.
Exactly.
Yeah. Number
Number three, what is your first purchase, whether significant or not so significant?
Her like no hold bar dream car now is a Maserati SUV, so we would go to the Maserati dealership.
Nice.
Because I already got my realistic dream car. I mean, I would get more, but like, yeah, that would be the first thing. Yeah.
Number four, would you live simple and no one would know you were loaded, or would there be signs?
I would probably start traveling a bit and own multiple smaller houses all over the world. So that would be peculiar, but I wouldn't like all of a sudden, I wouldn't start wearing skip timepieces and stuff like that. Like I would still dress how I dress and wear the same stuff that I do.
I think if you won $150 million,
Mm-hmm.
the timepieces that I like would not be an issue.
Yeah.
And they might be a little low brow
Yeah,
for
yeah.
you with that
Yeah.
kind of money. But I get what you're saying.
Yeah.
Number 5 kind of touched on this
Okay.
with number 4, but would you own more than one home? And if so, where would you consider moving or buying another home?
So we would go one in California, one in Tennessee, one in Costa Rica, one in Croatia, and one in Spain.
What is the
those-
connection to Croatia? Just curious.
I'm Croatian, and we are considering doing our honeymoon there, and we are looking at potential landing spots when it's time to leave this country, and Croatia is now in the lead.
Nice. All right. Did not know that. Number 6, do you take care of anyone in your family? And if so, who?
Yeah, like I would put $1 million in my less than 1-year-old nephew's bank account that he can't touch till he's 18 and stuff like that.
Cool. All right.
Mhm.
Number 7, you would likely clear around 80 to 90 million after taxes if you took the cash option. Depending, of course, someone will argue, depends on the state.
Yeah.
I'm in Florida, they're not taking any of my money.
Yep.
But if you're in California, New York,
Yep.
or Illinois, they're probably going to take a lot of your money. I get it.
Mhm.
Point is, you clear 80 to 90 million roughly. Would you invest or would you just ride on the interest of 80 to 90 million dollars?
Well, I don't think you would really need to invest with 80 to 90 million dollars with interest. So I would probably maybe invest like 5 of that in speculation stuff, but the rest just live off the interest. Like just make it easy. Obviously I would have a better finance person than who I have now, because that's a lot more money. But yeah.
I think I did. I was bored. I think I did the math one time, and it 4% if you invested 30 million, it would turn, after paying your financial advisor, taxes, everything else, it would turn $100,000 a month.
That's plenty to live on.
Yeah.
Yeah.
8, are you a charitable person / philanthropic? And if so, what might be the first couple of things you donated to or focused on supporting or funding?
Yeah. Oh, I've thought about this. I would immediately build and bring back multiple substance abuse treatment centers and mental health centers. I would probably do at least 10 to 20 million of that right away without a second thought.
I'm very similar. And I'm going to go so far as to say this. I think it says a lot about a person to come into that kind of money and not be philanthropic, even if you weren't before. I understand,
Correct.
Going out and taking care of your family and getting everything right. I understand that. But if 5 years goes by and you haven't done something to help someone or people, I think there's something really, really wrong with you.
Yep.
Number 9, would friends recognize you as the same person in 10 years?
God, I would hope so, but I don't know.
Hard to say, isn't it?
Yeah. You would like to think, but
I think it's a deep question that we might not know the answer to, but we would like to think that.
I would love to be blessed to have to find out.
Mhm.
Heaven
Absolutely.
forbid the man upstairs wants to smite me with that responsibility. Go for it. Smite me with money or whatever Fiddler on the Roof said, right?
Right. And number 10, what is something you would do if you came into that much money that might surprise me or any of your friends or your family? And that's a difficult question.
Yeah.
I understand. It's very open-ended. And they might just be surprised if, you were philanthropic and were very, giving and that sort of thing. And, I think it's a hard one to answer.
Maybe the amount, because like I said, I've thought about this of if I ever get in a position where there's a certain center that I owe my life to. So if I would be able to be like, hey, I could afford all financial costs for the year, I would do that in a heartbeat. So maybe stuff like that. Yep.
Understood. That wraps up this edition of Intimate Time with Skip and Dr.
That was fun. Okay, so if we rapid fire, we have to rapid fire because we're at about an hour, just under an hour 10. But I think I really think we could knock these out.
All
So, because we've had these same questions that we keep pushing back. So let's try and knock them out. So Lucas.bodybuilding asked this quite a while ago. It's a great topic. Chest pressing movements, to lock out or not to lock out. And he gives his thoughts, blah, blah, blah. But what do you say?
First, I want to say that I don't think that locking out is bad.
Okay.
But I'm not a lockout guy. I am more of a methodical, 7/8, 3/4 of the way to the top. I do feel that the chest doesn't get to rest. I don't feel that it gets to rest. But I think that we're really digging into the triceps at that point when it's at the very top of the movement. And I think that eventually will take away from the set. So I'm a 3/4, 7/8 kind of guy.
Yeah, I'm pretty much the same. Like if you're really, if you're doing close grip bench for triceps, you better be locking out.
Right.
Yeah.
Agreed.
But chest specifically for pecs, and everybody's different. Like people, what's your mind to muscle connection, blah, blah, blah. Are you a power lifter who's just dabbling in a hypertrophy block? But yeah, for the most part, because unless you're just really relaxing, hopefully you're advanced enough to keep flexing your chest the entire time, even at the lockout. So it's still firing. So yeah, I typically, what do you feel the best? But yeah, usually not to full lockout. Cool. All right, Lucas, there you go. Because you asked that a while ago, and I've literally had to keep pushing that off. Okay, this one will be fun. I think we could still knock them out. This was from Ground 3D Flygon. Cardio, underrated, overrated, necessary.
Overrated for getting shredded.
Okay.
Obviously, you're burning more calories. I get it. But the ROI goes down as the amount of cardio goes up. I think there's
because
also
you adapt to it. You adapt to it. People don't realize that.
And there's a lot of other things like if you're me and you're very sedentary, 30 minutes of cardio is a big deal. If you're an ER nurse that works 12-hour shifts, 30 minutes of cardio
steps a day
is nothing. So there's a lot of variables there that are important. From a health standpoint, if you're not very active and you're sedentary, it's huge. Blood sugar levels, appetite, digestion, heart health. People will tend to think, oh, I train really hard all the time. I'm breathing real heavy. That's great from a health standpoint, but it's not cardio. And there's a difference. Even just cardio increasing your oxygen uptake, your VO2 max is important for a health standpoint, and it will help your training. I have found that HIIT cardio has benefited me through prep where I'm putting up PRs I haven't put up since before my knee injuries in 2020. And that's as early as a week or two ago, 5 weeks out from a show, 6 weeks out from a show. It's huge. So I am also a fan of HIIT cardio if it's not too frequent and it's not too intense. It has to be balanced.
Yep. Yeah. I was going to say overrated for what people think it does. Incredibly underrated for the health stuff. You want to improve your lipid panel, do some cardio. It helps with your blood vessels. It can counteract some of the negative side effects if you choose to use super supplementation that we don't talk on here. Reduces inflammation. I hate doing cardio. I'm a retired sprint triathlete. Keywords were retired and sprint. So cardio gives me PTSD. But I am committing to it. Yeah, cardio for me is either super easy or super hard. I don't like the medium pace stuff. And typically I am super headstrong on, even in the off season, you're doing at least one HIIT cardio session a week for gym performance, let alone the heart health, because you want to keep something called myocardial contractility and just making sure your heart's responding right. It's pumping all the way, the ejection fraction. There's all these fancy terms I could use. it's massive to make sure your heart's functioning well. Now, yes, studies will say lifting provides all the same reduced cardiovascular risk benefits of cardio only, but ideally you're doing both. So I'm big
And if
on
you're not going to do any cardio, you better be lean and your diet better be tight.
correct.
Because if it's not, you have no excuse for not doing cardio.
And the last thing is 10-minute walks after meals has been compared favorably to prescription metformin, even for
Agreed.
diagnosed diabetics. That is such low-hanging fruit.
It is, but it's not very practical. Let's be fair.
Yeah. Well,
But
when I lived in California, I did that every time, no matter what. I live in Texas now. Nope. So I have a little exercise bike that I'll hop on. But there was a 7-year period. Every time I ate, I went for a walk without thinking twice about it. That became my lifestyle.
Absolutely works. Make no mistake.
Correct. So, and then I like Rob Bailey, Slay the Dragon. I hate doing cardio. So today is day number 2. So let's not all get too worked up. But I have gone on my treadmill. For 2 days in a row. I hate every minute of it, but I've committed to doing it. Awesome.
Fair enough.
And then as you get really lean, I'm not a fan of HIIT cardio, right? Like, do you change that? Like a lot of HIIT earlier in prep, as you get leaner, maybe start pulling that out a little bit,
Well,
or do you
it
just
comes
run it all
down
the way
because
through?
of just it's not as much of a necessity. But I have found that even though I'm decreasing frequency, I still will keep it in there, even if it's just once a week, because that benefit has been in there.
Yeah.
Now, if you were talking to me about HIIT cardio a year ago, I would not be on the same page.
Yeah. Yep. And HIIT cardio needs to be respectful. 2 more things real quickly. One, if you're doing 30 minutes of HIIT cardio, I'm sorry to tell you, you're not doing HIIT cardio.
Right.
Like
Agreed.
it is, I will program 4 to 8 sprints max. And it is, you're grunting. There's saliva coming out of you. You're like, somebody would be like, this is disgusting hearing you do it.
Yeah.
Like it's supposed to be all out, folks. All out. Okay. And then one last question from Cornelius Parkin 2401. He always has great questions and conversations. This was in regards to the trap episode that just came out. When we were talking about, like that prone raise for the middle trap in that one study that I was talking about, and how, it's a rehab exercise, not muscle growing. So it's a bit of a longer thing, but I think it's a great topic. Why is it quote unquote rehab if you can only use 15 to 20 pounds on a movement? I would have thought that as long as you're challenging the muscle, it'll give it a growth response. Meaning, if you could make the muscle fail after 10 reps with 20 pounds, why should the 500-pound movement grow any better? Is it just because the overall load is heavier? I've always thought about this. It's hard to target the muscle that works. But the heavier moves generally pulling in more muscle groups. So sure, you would get more overall growth, but the localized focused on a muscle, if it's taken to failure, why does the overall load matter? Great episode.
I mean, mechanical tension is still a thing.
Correct.
That's ultimately what it comes down to. So it's a very difficult question to answer because I like where he's going in his head. There's
thought-provoking.
Absolutely. So my response would be, I guess my best response would be, there's a balance between the amount of mechanical tension and the isolative effect of working that target muscle. So I would use the side lateral as an example. If you can loosen up and do a 40-pound or 45-pound side lateral, but it's not targeting the muscle as well, or you back off to a 35-pound, then it can be argued that, okay, there's more work being done with the lower weight. But if you drop down to a 20, do you really need to drop to a 20 to give up that much mechanical tension? So you want to get as much isolation as you can. You want to target the muscle as much as you can, but you still want to focus on as much mechanical tension as you can get to. And that's where it becomes very, very gray. I've been training for 41 years and I still sometimes will be like, I don't know, do I back off on this second set or do I stay with it? And that's all about that feel. It's all about taking into consideration the mechanical tension and the isolative effect of being able to target that muscle as efficiently as possible. And there's never a clear answer. It's a feel. when you finish that set, was it enough? Now, sometimes I'll be wrong and I won't be able to keep it. And that's when I might do a drop set right there on the fly. Like, okay, I don't want to loosen up very much, but I want more reps than this. So I'm going to start with the higher mechanical tension. And then I'm going to take a few breaths and I'm going to drop 5 pounds or maybe even 10 pounds and continue the set so that I get the isolative effect and I get as much mechanical tension as I can. It's a feel. It's an instinct, if you will.
Yeah, and research has shown as long as you're going to true concentric positive failure, 5 reps up to 30 reps can build muscle. I would say that 30 could go even higher if you're doing like the hardcore Widowmaker 50 plus rep sets, but you've got to hit failure. And a lot of times we tap out because lack of air, because you're not doing your HIIT cardio or it's so brutal. Well, and then, yeah, like one study that I had mentioned in the Dorian Yates episode where it's like, yeah, like 20% of your 1 rep max taking the failure will not build muscle. That's also a 7-minute set because it's so much, right? Like, yes. Otherwise, doing 500 reps with pink dumbbell, pinky twist stuff would grow 22-inch arms.
Or just doing side laterals with no weight at all.
Exactly.
You know, there's that. It's like, are your shoulders going to grow?
Yeah. Yeah. So unless you are coming out of a coma and so deconditioned, for the purposes of our podcast, it's just not enough. But great question. And yeah, his comment, he's an awesome dude. I enjoy chatting with him on social media quite a bit.
And he does have great questions.
Yep.
Which is not to say other people don't,
Correct.
but some people they're a little deeper.
But hey, we got through 3 questions. Yes, it was rapid fire, but that might be a personal record outside of our listener Q&A episode.
I agree.
Yep.
On that note, we got to get to getting. This is Skip and Dr. Marv splitting. If you enjoyed the show, be sure to like, subscribe, share, and ring the bell. It should sound a little something like this. And if you didn't like the show, just pretend you did. Like, subscribe, share, and ring the bell anyway. We want to hear your questions, feedback, and any ideas you have about future topics in the YouTube comment section. If your question or topic is chosen and used on the show, you'll go into a drawing, and we will randomly choose one winner at the end of each month who will receive a 5-pound bag of Team Skip protein from TrueNutrition.com. Be sure to use the TrueNutrition.com link in the closing credits to save 10% on not just Team Skip protein, but every supplement they sell. Not only do I use my Team Skip protein with my clients, but other top prep guys have their clients use my protein because it's that good. Dr. Marv, how can someone reach out to you if they have questions for you or if they want to work with you?
So I'm most active on Instagram at dr.marvin.saysdc. My office is in the Houston Bay area. Also have theeducatedmeathead.com. Don't forget I do consults. I guess I'm now doing custom workout routines because a couple listeners have asked. All that jazz, online bodybuilding anatomy course, blah, blah, blah. Hit me up on Instagram, go to the website, see a bunch of promo codes for there as well. And for what it's worth, I think I posted this last week, my True Nutrition order had 3 bags of Team Skip.
Nice.
And now you owe me a check in the mail.
It's on the way.
Yep.
If you have too much skin, I'm your guy. Go to teamskip.com and you'll find all of my contact information, including Team Skip merch. Of course, you can follow me on Instagram at Intense Muscle as well. Keep in mind that this is a team of 3, not 2. Chris is the enigma behind the scenes, and he is responsible for visuals and graphics. And he also plays a huge role in the creative process. This project would not work without him. So from all 3 of us, it's been a business doing pleasure with you. And join us again next week for another episode of Between Two Dumbbells.